Hello, my name is Ivica Rubelj. I'm working at Rubelj Boskovic Institute in Croatia, and I'm going to tell you something about mechanisms of fetal epigenetics that determine telomere dynamics and health span in adulthood. First, I'm going to tell you something about the basic mechanisms of aging, which essentially is cellular senescence. In culture, cells have a limited growth potential. At the beginning, they grow faster and they slowly decrease in their growth, and in the end, they stop dividing, which we call a Hayflick limit. During this process, cells change their morphology and they change their metabolism. When senescent, they enlarge 4 to 6 times in comparison to young cells, and they also change their metabolism in a way they release certain factors called senescent associated secretory phenotype that affects the surrounding tissues, surrounding cells, causing various changes related to aging and also inducing senescence in the surrounding cells. It is important that mechanisms that control cell divisions and the number of cell divisions are telomeres. Telomeres are structures at the end of linear chromosomes, and in a normal somatic cells they shorten with every cell division. Since number of shortening is limited, when they reach the critical telomere length, then these telomeres are recognized as DNA damage and they cause cell cycle arrest, and the cells are permanently then in this stage we call senescence, unable to make any more divisions. This leads to accumulation of senescent cells in the body over time, and we can recognize these cells by morphology and also by metabolism. Metabolic factor that we use for identification of senescent cells is senescent associated beta-galactosidase enzyme, which specifically stains senescent cells in blue. So we can distinguish them in young cultures and also in vivo in tissues. Here we can see accumulation of senescent cells in the skin. With age, at the age of 75, we can see individual senescent cells in the skin, but also at a smaller magnification we can see the accumulation of senescent cells in general. So in young people age 35, there are no senescent cells visible in this particular sample. So accumulation of senescent cells indeed is what is happening in vivo over time with aging, and we believe that this is the main cause of aging and all aging related changes in the organism. Of course, not only skin is analyzed, other organs as well, from blood vessels to lungs, kidney, liver, all major organs, and throughout the body we can detect accumulation of senescent cells with aging. Telomeres shorten in cells when they grow in culture, but also they shorten in a body with aging. Here we can see population studies age 30 to 85 for men and women. Men are blue and women are red triangles, and you can see that over time overall telomere shortening continuously progresses, but women always have about 10% longer telomeres, which give them also about 10% longer longer life. For European population, that would be 7 to 8 years difference today. Most critical telomeres are those that are shortest. So if we follow those shorter than 3 kilobase length, then we can see that those also increase with aging, and this time men develop more of these very short telomeres, and they do accumulate very short telomeres more quickly than women. Short telomeres are indicators of various diseases, including most common diseases with aging, like hypertension, metabolic syndrome, diabetes, and reduced mental capacity. So wherever individuals have shorter telomeres, they would get these diseases early in life than they controls with the longer telomeres. So telomeres are directly related to aging, dynamics of aging, and also occurrence of aging-related diseases. This brings us to our question regarding fetal programming hypothesis. From epidemiologic studies, we know that persons born small for gestational age, born earlier than a term, they have low birth weight, and also they develop these diseases, high blood pressure, metabolic syndrome, obesity, cardiovascular disease, and so on earlier in their life. And there are many hypotheses why this happened. They consider environmental factors like diet, quality of diet, and all stress of mother when pregnant, and also some metabolic factors, which means health of a mother, and some health conditions of a mother. All that have influence on normal development of a fetus. Those individuals that are born with a low birth weight, they have to catch up in their growth, and they have changed expression of certain genes and proteins in the metabolism, which can affect the angiogenesis and also development of diseases related to insulin resistance, mitochondrial dysfunction, or oxidative damage and sensitivity to oxidative damage, and all these things can lead to development of these diseases earlier in life. What we were interested in, we wanted to see what happened with telomeres in these people regarding the development of these diseases and their age. So we were analyzing telomeres in for a subgroup of young men. They were all aged 20 to 23. We divided them in four groups, expressed here as quartiles. in the first quartile are those that are born 3 months before term, then quartile 2 2 months before term, quartile 3 1 month before term, and quartile 4 are those who were born on term. As you can see, average telomere length is higher for those who were born earlier than a term, and as they approach the normal birth term, the telomeres on average are shorter. So this is somewhat contradictory what we expected. We expected that these individuals born earlier than a term would have a shorter telomeres because they develop disease earlier in their lives. So we wanted to see what is the dynamic of the telomeres regarding dynamic of their loss, and as you can see here, when they're divided into 4 subgroups regarding the age 20, age 21, 22 and 23. Those who are born earlier than a term are here depicted with this black squares, and controls are gray squares. You can see that they do have longer telomeres, but even in this short period of time of only 3 years, you can see that the dynamic of telomere loss is greater in those who were born prematurely, meaning that they are losing their telomeres faster. So we expect that they would have same telomere length as controls in their early 40s, but in their late 40s and early 50s they would have a shorter telomeres, and that is the time when they develop these diseases earlier than controls. So they do have longer telomeres, but they're losing these telomeres faster because they for some reason are not stable enough. So we wanted to see if we can figure out what would be the mechanism for this, placental insufficiency can lead to alteration in glucose and amino acid supply, also in fetal triglycerides supply, but we believe that the most important factor related to telomeres would be alteration in oxygen supply through mild hypoxia. This mild hypoxia would cause activation and increase in activity of hypoxia-induced by factor 1 alpha, and this factor then acts in 2 ways. In one way, it reduces activity of DNA methyltransferases, which then cause the general DNA hypomethylation, and this also refers to telomerase regulatory region, which enable hypoxia-induced by factor 1 to increase telomerase activity. All these things then cause telomere elongation, because telomeres are more relaxed, and the increased telomerase activity results in telomere elongation. On the other hand, these telomeres have changed epigenetics. They're not that stable, and they have increased rate of telomere loss. So in short, we believe that in the normal conditions, when we have adequate fetal oxygen supply, we have telomerase regulatory region methylated, and the normal activity of telomerase in all cells in fetal tissues. And also we have highly methylated subtelomeric region and stable telomeres. In this case, telomeres are they are shorter, but they are more stable, and they lose a small portion of their repeats with every cell division. On the other hand, this fetal hypoxia would lead to changes I mentioned before, and these changes then causes the demethylation of telomerase regulatory region, which enable HIF1 alpha to activate telomerase, because there are sites for its activation on telomerase regulatory region, and at the same time these subtelomeric regions are hypomethylated, which relaxes telomeres and enable this increased telomerase activity to elongate these telomeres, but they are not as stable as with these normal conditions of adequate fetal oxygen supply and normal epigenetics. Thank you very much for listening.